Year's, everybody. I hope everybody had a really, really good holiday season. I did. It was really uneventful. I didn't really do a whole lot. But it was good to have some time to myself for sure. Explored the cosmos with some psychedelics. A little psilocybin can go a long ways. So speaking of symposiums, and I look forward to getting that book, so I'll check that out. But today, I've been posting about, and we can go wherever this conversation goes as always, but just a little fun pearl to kind of kickstart us a little bit. Couple things. One's an announcement and the other more of a pearl. I posted today, there's this post. I recycle a lot of my content on social media, as you should, because just because you post it once doesn't mean people see it. Social media marketing, that could be its own mental health Wednesday subject of how to gain traction with social media marketing, which I've learned a thing or two about over the years. But it was interesting to see today and kind of see how my post is performing, because what I posted today to Instagram and then I shared it to my Facebook pages, I think is the single most important PTSD and trauma related post that I've ever seen. Now, obviously I'm biased because I wrote it, but knowing what I know scientifically, I think it's the most valuable post out there. And there's a lot of trauma content on social media these days. And, trauma has become this really trendy topic on social media. So I'm going to read, and this is a direct research quote. It's not my own words. It comes directly. I even cited the research study underneath the quote. Our results demonstrated that microglia are the major brain immune cells that respond to PTSD, and microglial activation plays a critical role in PTSD development. Microglial inhibition is a potential therapeutic strategy for the clinical treatment of PTSD. I like using research quotes because it's like I don't know how we could say it any more directly. So when we're talking about let's say trauma spectrum disorder and PTSD and severe is kind of the lower functioning side of that kind of trauma spectrum. And I'll be curious to see what you all have to say along these lines, because what I see, I'm really good friends with Dr. Nicole LePera, who is the holistic psychologist on the internet. She's become this kind of global phenomena, and a lot of her work centers around trauma and trauma awareness. And although I want to make myself very clear of like, I deeply respect and love Nicole. We had lunch a few weeks ago. She's great. I love her work. And she's very good at communicating her truth, her message to the world. The question is, how does the world receive it and interpret it, and what do they do about it? And so now there's kind of this growing thing going on in the social media world where now everybody identifies as being traumatized. And my personal opinion, I don't think identifying as being ill, I don't think identifying as being traumatized is very conducive to healing or health or becoming not traumatized, right? So there's definitely a lot that could be unraveled with, like, what do you do with a client or patient that is identifying with their illness or identifying as their illness, whether it's PTSD or ADHD or whatever. Keeping in mind, like, I was officially diagnosed with major depressive disorder and ADHD at the age of 21. I've never identified as having either of those things, right? Now I'm doing what I'm doing today. So my point being, I think there's kind of this unintended side effect of trauma awareness and trauma sensationalism, where now everybody is wanting to, I have trauma, and that one time where my father was not completely emotionally available, I'm going to hang all of my life problems because that was traumatizing to me, right? And there's a lot of psychological dysfunction with unpacking that. All the while, my point being, and I've had some good dialogue with Nicole, and well, actually two Nicoles. There's Nicole LePera, but I also, for those of you that tuned into my interview with Nicole Berkins from Microbiome Labs for the clinical grand rounds, Nicole's a psychologist, right? And she's a really, really intelligent practitioner. I did a clinical consult with her on one of her cases a couple of weeks ago. And just, that was the first time I really interacted with her in kind of a one-on-one way like that. She's really, really knowledgeable, really impressive, and with her background as a doctor of psychology. So I'm really impressed with her ability to combine clinical psychology with functional medicine. But she was very, very receptive to everything I was throwing down in regards to the neuroinflammatory microglial modulation side of it, right? So my point in reading that research quote, which is a direct quote, they've done a lot of research. There's more of the observational research with humans looking at, people with PTSD, people with trauma, they have higher levels of inflammation, higher levels of microglial activation, so on and so forth. But then they have this mechanistic animal research, mostly with rodents, where, they'll shock their paws or force them to do the, forced swimming test or, tail suspension to traumatize them and induce, an HPA activation, a microglial activation. And then usually the main therapeutic agent that they use to inhibit the microglial cells is minocycline. So tetracycline antibiotic is usually dosed at 200 milligrams per day for, antibiotic purposes. But minocycline, from the research that I've done and do, minocycline is kind of the number one thing that they're using in clinical research to study microglial inhibition. You have these innate immune cells of the central nervous system. They get provoked by a lot of different input signals. They become activated into their M1 phenotype, which is cytotoxic, pro-inflammatory, neurodestructive, so on and so forth. And minocycline is the main thing that we know crosses the blood-brain barrier and calms down those microglial cells to return them to a more quiescent morphological state. Being ultimately, with all of this kind of heightened trauma awareness, trauma spectrum recognition, a lot of people now starting to identify as being traumatized, whether that's really valid or not, it's case-by-case basis. But my concern is that there's a hyperfixation on more the psychological approach to trauma, all the while emerging evidence is making a very, very objective, measurable, concrete argument that, hey, you could do decades of therapy, that's probably not really going to inhibit the microglial cells. Whereas like what we see through the rodent research is that when we traumatize these rats, they behave like they're traumatized. They express anxiety-like behavior, depressive-like behavior. They act like they're depressed. They act like they're anxious. They act like they're traumatized. But then when they're treated with a microglial inhibitor, like minocycline, their PTSD symptomology and behavior goes away. So I just to me, that's so mind-bending and powerful from a neuroendocrine immunological perspective of I don't think trauma and PTSD is what we've thought it was, right? And I have a lot of thoughts on the matter that we don't need to get into today, but we have concrete objective evidence that shows if we actually treat the cellular dysfunction, the symptomology that we qualify, that we label as PTSD, kind of goes away. So it's maybe this isn't such a psycho-emotional thing that you need to do decades of psychological therapy for. Maybe if we actually treated the neuroinflammation, treated the cellular dysfunction, we can move our clients out of trauma. And I don't know about you all, but I have a lot of clients that identify as being traumatized, identify as having MCAS and mold illness and mitochondrial dysfunction and all of these many things that they kind of hang their hat on of that's why I'm so all over the place. That's why I can't get better. And it's well, I can't help you get better if you're identifying as having all these illnesses that prevent you from getting better. You have to identify with your healing, not identify with your sickness, right? But again, all the while, their emotional state, they're convincing themselves of all of these things, these concepts, all the while man, if we just gave them the right pill to calm down their microglial cells, they might actually be more work withable, right? So it was a little bit sad to me that my post is not performing well. I'm speaking in a language that people don't understand. I'm talking about microglial activation, excitotoxicity, neuroinflammation. People don't know what the heck that means. And that's not as trendy, it's not as sexy, and it's not as enabling as saying, yes, all of your feelings are valid. You are traumatized. You poor little victim, you, right? That's kind of the message in the narrative that these people are getting. And I don't think that's at all conducive. It's actually kind of enabling, their belief system that's keeping them stuck in illness, right? So a huge part of what I try to do, and this is where my announcement, just a quick little announcement of the mental map is live, it's out there. We're, starting to try to get it out to the world and, all the things. And that's really why, like, I used my post today to try to promote my lab test. Of course I'm going to do that, right? Because I'm trying to use objective, measurable data to move people out of those toxic belief systems, right? Because if I can measure biomarkers that are very sensitive to being proxy markers and reflective of neuroinflammation and microglial activation, I can show them with reliable, sensitive data, like, is what they're doing working or not? And how does their belief system play into that? Because something about me, I'm a very psychological and physiological minded practitioner. I think we all are here. That's why I can say this stuff to you all, but other people have no idea what I'm talking about, because we have to do both, right? Like, we have to cater to the psychological dysfunction and the faulty belief systems, the self-limiting belief systems, but we also actually have to address the physiological dysfunction. And it's really hard to do both because people are very caught up in their narrative and their belief system that maybe is not even their own, right? All the people that come to me saying I have MCAS, and I'm like, who told you that? And what's that based on? Who told you that you have this pseudo diagnosis that's not even like a real diagnosis, right? And is that helpful? Well, I can't eat anything, I'll have a flare up. Is that actually true or not? Like, you have to tease that out rather than accepting it at face value, because otherwise it's just a self-limiting belief system. And then they're not even nourishing their body because they've been convinced by someone else. So you have to really look at what is the client's behavior and their belief system and kind of challenge those belief systems through motivational interviewing, because maybe those belief systems that are self-limiting are not even their own. They were programmed and domesticated into them by, who knows, society, loved ones, practitioners that they've been paying. But at the end of the day, this is why I'm so big on sensitive, reliable, objective lab testing data, is that way, regardless of the intervention strategy, whether we're trying to move them out of their trauma and PTSD or whatever the issue is through psychological coaching and motivational interviewing, or whatever, esoteric, spiritual, whatever, or we're just giving them pills, either way, at the end of the day, are the biomarkers moving in the right direction? So the case study that I used for that clinical grand rounds presentation, I think I've shared a little bit about that presentation, because I actually took one of my clients' mental map results, 3 of them. It was pre-protocol, post-protocol, and then post-vaccination by 2 weeks. And you can see the very sensitive biomarkers of, like, pre to post-protocol, everything except for histamine got better because she's allergic to her cat and she won't get rid of the cat. But everything else got way better. Neoterin, MMP9, CRP, MPO, the copper to zinc ratio, which I'm finding the copper to zinc ratio to be one of the most sensitive biomarkers of, like, anything. So it's like, if the copper to zinc ratio is getting better, I know whatever we're doing is working. If it's getting worse, I'm like, all right, things not really working, but it trends with all the other data points. So anyways, that's why I'm so excited about the test, is like, I hope to have a positive impact on this whole trauma identification situation and all the other mental illnesses around it. At the end of the day, though, we have to have good data, right? You can't fix what you don't measure. And I think one of the most consistent themes that I see in functional practice and with the behavior of our clients and patients that we're trying so hard to help is really being able to, like, disentangle a physiological dysfunction storm mixed with this psychological belief system storm. How do you begin to unpack that, untangle that, break it down into individual healing opportunities, both on the psychological belief side and the physiological, kind of mechanistic clinical side, if you will. But I think we as practitioners are going to get kind of torn up and worn out and burn out if we don't know how to kind of ground our clients in like objective reality, right? Because if we're just chasing functional lab test after functional lab test and chasing all the root causes all the while, this is something I ask myself all the time. What am I doing as the practitioner that might be enabling their self-destructive behaviors or enabling their self-limiting beliefs? Because we don't want to do that. That's not in their best service or ours, because then we just kind of dig ourselves deeper and deeper into a hole. So anyways, just a few thoughts I have had because I've been posting about trauma and I see how not receptive people are to it, which tells me people are much more fixated and fascinated with the idea of identifying as being a traumatized victim rather than interested in objective science that could help them move out of that. And that might be an offensive statement to some. I'm sure somebody would get offended. Otherwise, I'm not doing it right? Because everybody wants to be offended today. That's part of the problem. It's this cancel culture cop-out of like, I don't have to show up for life. I don't have to debate. I don't have to be reasonable. I'm offended. And I see this all the time in functional practice. It prevents me from being able to onboard new clients because I see that belief system and that ideology. I can't help somebody that doesn't allow help and isn't open to having their belief systems challenged. So I think we as functional providers, I think we have the hardest job in the world. We have to provide solutions and answers for what nobody else has been able to, even the 10 other functional providers that they've already worked with. And that's what this community here is. We are those practitioners, right? So anyways, that's my rant, but I'm happy to open up any dialogue around this or any input. Emily, really good to see you here. Tuning into Mental Health Wednesday.